Now, next we'll moving on to the keynote talk on dietary therapies in pediatric neurology beyond epilepsy by Dr. Hyung Dong Kim. I would like to request Dr. Gurpreet Kochar on the chair, please.
Yeah, good morning. Can I have the CD slide of the speaker, please? Yeah. So it's my pleasure to introduce Professor Hyung Dong Kim, who is a professor in Canberra Samsung Hospital. He graduated Yonsei University, University College of Medicine, and trained at Severance Hospital in Pediatric and Pediatric Neurology, and has spent 2 years of exchange fellowship program in Philadelphia. I invite you, sir, for the talk on dietary therapies in epilepsy.
Thank you, Chairman. I would thank also to Scientific Organizing Committee to invite me to this wonderful Congress. My talk will be dietary therapy in pediatric neurology beyond epilepsy. Ketogenic diet is the most potent anti-epileptic treatment among non-surgical modalities, and it does have benefits to prevent major cognitive side effects from multiple medication. And it also has hazard condition because of its most difficult treatment of prolonged maintenance, and many early and late complication is also the other part of the ketogenic diet. Since its resurgence from 1994, the ketogenic diet publication became became much more popular to this age. Mechanism of ketogenic diet is not all clearly determined, but ketogenic diet from the ketogenic diet elevated fatty acid, free fatty acid, and reduced glucose, which eventually reduced glycolysis, is the key reaction from ketogenic diet. From this metabolic changes from the dietary treatment eventually can provide increased GABAergic output and stabilize the synapse function to make anticonvulsant action. Not only from the anticonvulsive action, reduced ROS synthesis, which is quite neuroprotective changes in cells, and increased energy production with OX-phos-ATP production make reserves of the dietary reserves of energy in neural cells from ketogenic diet. This is a revised, updated mechanism of action, not only ketogenic diet, but modified Atkins diet, low glycemic index treatment, MCT treatment, and calorie restriction itself also cause reduced glycolysis and increased fatty acid oxidation, which can cause intracellular and genetic changes, gene functioning with upregulated and downregulated many parts of the genetic action. It reduces mTOR activity, and it enhances AMPK, PPARs, and sirtuins, and it reduces downregulate HDACs, which eventually provide increases synaptic integrity and increase bioenergetics and reduce reactive oxygen synthesis to provide neuroprotection. Calorie restriction itself can provide changes in certain AMPK, total protein, and insulin signaling, make changes in metabolic rate, which can cause reduce cancer production and cancer proliferation, and it improves the mood and behavior, and it increases DNA repair to make better health and longevity. Energy sensing signaling pathway like sirtuins are upregulated from ketogenic diet, which provide increased DNA repair and increased telomere maintenance, and also inhibit inflammatory action and also inhibit Warburg effect, which provide better ROS production. And in gut microbiome, ketogenic diet provide decreased gamma glutaryl amino acid in colonic luminal metabiome, and in blood metabolome, it decreases gamma glutamyl amino acid production and increase GABA glutamate content in brain. This is my data. Focal cortical dysplasia was caused by mTOR activation from somatic mutation. As you can see from here, in focal cortical dysplasia type 2 has increased mTOR protein in brain tissue as compared with the wild type, and we found this some genetic mutation in mTOR protein, which eventually caused focal cortical dysplasia. We also produce genetic mutation in embryo rat, which cause focal cortical dysplasia in rat, and they showed a lot of spontaneous seizures from the focal cortical dysplasia, and which was reduced by mTOR inhibitor rapamycin, which caused significant seizure reduction from the seizure from focal cortical dysplasia. So ketogenic diet has like a catabolic state. Ketogenic diet also has significant reduction of mTOR activity, like mTOR inhibitor. Catabolic state like ketogenic diet also inhibit mTOR protein activity to make seizure reduction. So sequence of ketogenic diet in brain cells shows also improving energy metabolism, anti-inflammatory activity, and regulating neurotransmitters, and inhibiting mTOR signal pathway in brain, and also modulate gut microbiomes, increasing the benefit microbiota and metabolic profiles. In precision medicine era, many genes can be modified by established treatment, like mTOR inhibitor in tuberous sclerosis complex. But GLUT1 gene mutation, SLC2A1 gene mutation has GLUT1 encephalopathy, which the ketogenic diet is established only treatment for GLUT1 genetic mutation. In GLUT1 deficiency syndrome, they have not only epilepsy clinical phenotype, also have movement disorder together, and its clinical phenotype is very wide, and the spectrum is from a very mild form of epilepsy and movement disorder to a very severe form of GLUT1 encephalopathy, which shows complex motor disorder and very severe intractable epilepsy. Ketogenic diet can be used in many types of genetic mutation. We investigate the efficacy of ketogenic diet in specific gene mutation in developmental and epileptic encephalopathy. And we found that many channelopathy like KCNQ2, SCN1A, SCN2A is very effective to be controlled by ketogenic diet than other types of genetic mutation. And CDKL5 is not so effective from the ketogenic diet. And STXBP1 and other condition in synaptic transmission genetic mutations are also effective to be controlled by ketogenic diet. Other than epilepsy, autism, brain tumor, depression, narcolepsy, glycogenesis type 5, Alzheimer, traumatic brain injury, Parkinson, ALS, migraine, sleep disorder, and post-hypoxic myoclonus has been tried to use ketogenic diet to improve their clinical outcomes. In autism spectrum disorder, not only associated with epilepsy, but autism spectrum disorder itself without epilepsy also has significant benefit from ketogenic diet, from the use of maintenance while using ketogenic diet in maintenance. This is CARS scoring as the duration of ketogenic diet is while on ketogenic diet. CARS scoring is reduced by time every their observational studies. In prevention and treatment of cancer, normal cell with glucose reduction with ketogenic diet can make ATP by ketone bodies, but cancer cell used to use glucose, a lot of glucose to make their cell proliferation, but limited use of ketone bodies to make ATP, which eventually reduced the proliferation of cancer cells. In treatment of cancer, ketogenic diet can reduce the tumor growth and invasion and progression by way of reducing Warburg effect and reducing inflammation and many intracellular changes with reduced glucose uptake and lactate to reduce ATP production. From this effect, many brain tumors like glioblastoma and glioblastoma multiforme and glioma has been treated with ketogenic diet with a significant benefit to reduce the brain tumor size, and some of them could make a complete remission from the dietary treatment. Other than brain tumor, like rectal cancer, breast cancer, and lung cancer, they treated the ketogenic diet with a significant benefit in many cases. Ketogenic diet is also effective in depressive disorder. With ketosis, it makes reduced GABA transaminase and increase glutamic acid decarboxylase, which increase GABA level in brain, which reduce epilepsy and depression. In Alzheimer's disease is typically characterized by neural cells and astrocyte hypometabolism, and increased beta-hydroxybutyrate counteracts to hypometabolism, and it also reduces anti-inflammatory action to having anti-inflammatory mechanisms. And beta-hydroxybutyric acid level is related to improve memory function from the mechanism changes. Traumatic brain injury insult have a primary injury from trauma, but secondary injuries can produce more neuropathologic changes with neurodegradation, cognitive dysfunction, and neuropsychiatric comorbidity by secondary injuries, which is coming from excitotoxicity, calcium overload, and impaired glucose metabolism, and increased oxidative stresses, and mitochondrial dysfunction and inflammation, which can be benefited by post-traumatic energy crisis from ketogenic diet. So in ketogenic diet can inhibit neurobehavioral dysfunction, axonal injury, microglial activation, and astrogliosis to make neuroprotection, and also inhibit inflammatory cells, inflammatory action from gut microbiome to make anti-inflammatory action to save brain function from traumatic brain injury. Ketogenic diet is also effective in reducing severity and frequency of migraine, as you can compare from here before and after during ketogenic diet. Migraine attack frequency is much improved, and attack duration is much shortened from the dietary treatment. In sleep disorder, ketogenic diet also shows hormone secretion changes and appetite regulation, and improve sleep pattern with non-REM sleep increase. Non-REM sleep and sleep quality is improved, and increase REM sleep with better sleep qualities. This is a dietary logo from Epilepsy Foundation of America. Dietary therapy with a ketogenic diet and modified Atkins diet can be used in epilepsy, autism, migraine, cancer, and dementia. This is my previous. I'm working here in Gangbuk Samsung Hospital after retirement of Yonsei University. Thank you very much for your attention.
Thank you, Dr. Kim, for a very nice presentation and that shows the pathogenesis of ketogenic diet in details. I would like to ask about, in your center, you have tried ketogenic diet, or you have an experience in other than epilepsy?
Mm-hmm.
Yes, okay. I would
Yeah.
like to know in what cases you have used in your center.
Sometimes the same genetic mutation can cause a wide spectrum of clinical spectrum, not just epilepsy, but they also have autism, developmental problems, sometimes associated with epilepsy, but they have autism or developmental disorder not associated with epilepsy. So in those cases, we can try dietary treatment in addition to making some other intervention. And autism spectrum disorder has a significant benefit from ketogenic diet while maintaining the dietary treatment in prolonged use. As we can start as a trial basis, and 3 months or 6 months later, we can find the outcome of the dietary treatment in their developmental progress, and we can decide to continue or discontinue at the time of dietary treatment.
You are giving the keto diet in addition to casein and gluten-free diet, or you keto only in autistic patient?
It's a part of multimodal treatment, so the ketogenic diet all together with other intervention.
Okay.
Thank you very much for your presentation. I wanted to know, as you've been doing all this work through your experience, how have these diets been formulated from the beginning to getting the actual diet? Do you get them when they're already marketed, or do you get a dietitian or nutritionist whom you work with to come up with a formulation of this diet?
Okay, dietitian have a major role to introduce a ketogenic diet, not only for the ketogenic diet, but they also provide modified Atkins diet and low glycemic index treatment. And the key action of dietary treatment is reducing glucose uptake and reducing calorie intake. So many other modified condition of a ketogenic diet, like low glycemic index treatment, which is very similar to diabetic diet, and it does provide same metabolic changes in cells and they can provide a similar action from the ketogenic diet. And we have ketogenic milk like Ketocar. We do have our own developed ketogenic formula, which is Ketonia in Korea. So Ketonia is used for supplementation of usual diet and carbohydrate restricted diet with the supplementary Ketonia to provide the better ketosis and to make the effect of a ketogenic diet.
Thank you, Dr. Kim. Is there any questions?
How about the side effect renal stone for after we give the ketogenic diet, and how about can we give for the kid under 1 year old?
Side effect from classical ketogenic diet is much more severe because very restricted carbohydrate diet with high fat lipid intake, and other than classical ketogenic diet like modified Atkins or low glycemic index treatment, they usually acceptable for better tolerance of maintaining for prolonged period of time. So not only for ketogenic diet, but low ratio dietary treatment can also have a benefit from other conditions but epilepsy.
So thank you. I think thank you, sir, for the wonderful talk. We close the session now.
Okay, thank you very much.